Historically, many Indigenous patients and families have experienced trauma and intergenerational trauma, and they have stories of that from their families, their parents, their grandparents, throughout society. And so they bring that with them when they access care in our systems.
So the responsibility of the healthcare teams is that we all have a role in providing culturally safe practices within the healthcare system. So as nurses, physicians, allied professionals, and all other staff, it's important that we build relationships with our Indigenous patients and families to provide a culturally safe environment.
The Indigenous Self-Identification practice is a practice change that was driven through CST Cerner. And what it did was allow staff right at the entrance point to ask patients and families with a culturally safe approach if they identified as First Nations, Métis, or Inuit.
Which is so important for advocacy with our patients and families because they may be too shy or afraid to speak up, but they're feeling safe to talk to an Indigenous patient navigator or an Indigenous discharge liaison. When they identify, they are able to access Indigenous Health services. Once we receive a referral through CST Cerner, our families are provided cultural support services, anywhere from advocacy to baby bags. We also provide cultural supports if it comes to ceremony. We are able to organize that in real time because they are referred to us as soon as they are admitted to hospital.
There's a really wonderful story that we've had here at BCH, and it was our first referral through the Medical Infusion Clinic that prior to CST Cerner, we would never have accessed that patient population. But because that referral was so simple and so fast, our team could go there on that one day that they're accessing medical infusion and care for that patient.
At BC Children and Women's, we are able to also provide education and supports for staff because that's part of our job.
One of the great benefits of CST Cerner is that it connects all the sites that have CST Cerner live for patients that are accessing care at different hospitals. That journey goes with them. So you will know if they identify as Indigenous, which means that we can offer them Indigenous services and wrap around them throughout their whole stay in care. We're asking this to make the experience better for Indigenous patients and families.
I think it's how we ask the questions will help our families feel safer.